The concern about MPox, particularly this strain of MPox, is that it is more like smallpox than the MPox we experienced 2 years ago.
Welcome to Global Dispatches, a podcast for the foreign policy and global development communities and anyone who wants a deeper understanding of what is driving events in the world today. I'm your host, Mark Leon Goldberg. I am a veteran international affairs journalist and the editor of UN Dispatch. Enjoy the show. On August 14th, the World Health Organization declared MPox to be a, quote, public health emergency of international concern. This is the highest level of alarm that the WHO can summon to confront a public health crisis, and it was triggered in response to a fast-spreading outbreak in Central Africa. As my guest, Dr. Eric Toner, explains, this MPox outbreak is different from the previous MPox outbreak of 2 years ago, for the fact that this new strain of the virus is both more deadly and more transmissible. Dr. Eric Toner is a senior scholar at the Johns Hopkins Center for Health Security, and he explains the difference between the strains and what we thus far know about how MPox is spreading within Central Africa. And as of recently, this includes a spread to other continents. We have a long discussion about how to contain the outbreak, which includes deploying effective vaccines. So if you can tell from my voice, I am a little under the weather at the moment. I kind of suffered through this interview. Thank you to Dr. Eric Toner for indulging me, but not COVID. My improbable 4-year streak of not testing positive for COVID continues. For now, at least. All right, here is my conversation with Dr. Eric Toner of the Johns Hopkins Center for Health Security. Thanks so much for speaking with me. Eric, last time we spoke was a couple of years ago, the last time there was an MPox outbreak. Could you just remind listeners, what is MPox and what makes this outbreak different from the previous one that you and I spoke about a couple of years ago?
Well, MPox is the new name for monkeypox. It was changed sometime in the last few months because it was felt that somehow monkeypox wasn't appropriate. So it is the same general species of virus as the one that we've experienced previously, but it's a different clade. That is, it's a different strain.
Yeah, this term clade is one that comes up frequently when referencing MPox. Can you just explain what that is?
It's a subcategory of the virus, kind of like the difference between genus and species. There are several clades of MPox, just like there are several clades of many other viruses. The virus that caused the outbreak that started in 2002, a couple years ago, and caused disease in over 70 countries was clade 2. Clade 1 has been endemic in Central Africa, particularly in the Democratic Republic of Congo, for decades. Typically, it caused relatively mild disease, but more severe disease than the clade 2 that we experienced in the US and that many other countries experienced a couple of years ago. But now there is a new clade, clade 1b, which is first appeared back probably in September, so almost a year ago, was first recognized around the beginning of this year. And it has been spreading very rapidly through Central Africa. It appears to be somewhat more severe than the clade 1 that we've known for many years. And it seems to have a somewhat different transmission dynamic, although it looks like it probably started amongst miners in these terribly crowded, poorly ventilated mines in Central Africa, but was then also spread, was encouraged through the sex trade, through sex workers. But it has been transmitted also to the families of miners and sex workers and others in the community, including children. So a fair number of these cases are among children.
And so it spreads mostly through close physical contact. Is that right?
Yes, it requires close physical contact, usually intimate contact, which is why that is often spread through sexual contact, but can also be spread by the kind of contact that mothers have with their children or other people can have who are just living in very close quarters.
Hmm.
So it has now spread from the DRC to at least 12 other Central African countries, some of which don't border the DRC. So presumably there's transmission going on through several countries. And there have been solitary exported travel related cases in Sweden and, as of today, in Thailand.
And so, what makes this a public health emergency of international concern? The kind of highest alarm that the WHO can summon has been triggered because of this outbreak.
It certainly is a public health emergency in Central Africa, amongst the countries that have cases and have ongoing transmission. But the concern about MPox, particularly this strain of MPox, is that it is more like smallpox than the MPox we experienced 2 years ago.
What do you mean by that?
The clade that we saw 2 years ago typically caused just one or two lesions. Often they were on the genitalia. It rarely caused disseminated disease, that is, pox all over the body, like we've seen in the old pictures of smallpox. We are seeing pictures now of children with MPox in Africa who look very much like the smallpox pictures of old.
And you're saying of old because the world successfully eradicated smallpox in the early 1970s. It has been wiped off the face of the earth, but MPox is of a similar variation, I suppose.
Yeah, MPox is the cousin of smallpox. And because, at least in some cases, it appears to be more disseminated, it means that the more lesions you have, the more pox you have, the more likely you are to infect somebody else. And so we're concerned that this may explain why it's being transmitted as widely as it has. There have been over 15,000 cases so far in Central Africa just since January, with a case fatality rate of about 3%. So 3% of the people who've been identified as having it have died. These numbers are very early. Testing in Central Africa is pretty poor. The healthcare is not great either. So that doesn't necessarily mean there would be a 3% case fatality rate in the US or other industrialized countries, but it's still a high number, worse than what we experienced previously with either the endemic MPox or the one that caused disease throughout the world 2 years ago.
So it's a deadlier and more transmissible version of that outbreak of 2 years ago. And interestingly, you mentioned earlier that like the modes of transmission that we've understood thus far has been largely like around sex workers, and I take it as well truckers as well, and that has kind of helped the spread in the region.
Yes.
Whereas the previous MPox outbreak was largely limited or contained to men who have sex with men. This is of a different kind of variety, I suppose.
Yes. There's a lot we don't know yet about the epidemiology of the current outbreak. And so it is likely that there is transmission among men who have sex with men. But there also is clearly a lot of transmission that's going on otherwise.
So last time around, the previous MPox outbreak of 2 years ago, we were able to contain it largely through social interventions and vaccines.
Yes.
what is the, I suppose, current state of play of international efforts to contain this outbreak, again, which is deadlier apparently and more transmissible than the previous one? Where do things stand right now?
So I should say that MPox, like smallpox, the transmission can be interrupted by things like isolation, like wearing gloves and gowns, and those things are reasonably effective because it's not transmitted through the air, it's transmitted by physical contact with somebody. But the real solution to this is vaccine. Almost no one in the world who was born after 1980 has been vaccinated for smallpox. And smallpox vaccine is what we use as a vaccine for MPox.
Oh, so the same vaccine that was used to eradicate smallpox is effective against mpox.
Yes,
But people like me who are born after 1980, we didn't get it.
right. And actually, in the US, we stopped vaccinating in the US, I think, in around 76, but it was officially declared eradicated in 1980, and no one in the world, with a few exceptions, has been vaccinated since then. So that makes the world vulnerable because very few people have had mpox. Essentially, no one's been vaccinated. And so it's a completely epidemiologically naive population. And so that's of concern. So, with regards to the vaccine, the Africa CDC estimates that it will take 10 million doses of vaccine to control this outbreak, 3 million doses of which they need right away. So far, the US and Japan have indicated they are going to share some vaccines from their existing stockpile. But the amount of vaccine that they're talking about is in hundreds of thousands of doses rather than millions of doses. And so Bavarian Nordic,
The Danish company, right?
yes, that makes the most commonly used vaccine, Jynneos, estimates that it's going to take maybe up to 18 months in order for them to be able to produce 10 million doses. Now, there are some other vaccines. A Japanese company, KM Biologics, has had for a number of years a smallpox vaccine called LC16, which should be quite effective, and they are donating to the DRC. A company, Emergent Biosolutions, which is a US company, has pledged 50,000 doses of its ACAM 2000 vaccine. The trouble with that vaccine, which is essentially the smallpox vaccine that has been used for many, many decades, is it can't be used in people who are immunosuppressed, which means it can't be used in people who have active HIV. And a huge portion of the population of Central Africa has HIV, and many of them haven't been tested. So that has limited applicability.
I mean, the numbers you're sharing, though, 50,000, a few 100,000 here, seem to pale in comparison to the 10 million doses that the African CDC identified. I mean, does there exist currently in stockpiles around the world 10 million doses of this? Are countries that have these doses hoarding them? You mentioned that it would take that Danish company 18 months to get to 10 million doses, but does there even exist in the world today that number of doses?
I think there probably does. How much vaccine is available across the world is a figure that's not publicly available. At one point in 2001, the US had 30 million doses of smallpox vaccine, but those doses have expired a long time ago. So I don't know how much vaccine exists. I would bet that it's over 3 million doses, but whether or not countries are willing to give away all of their vaccine or a majority of their vaccine is unclear.
Yeah, I mean, I'm just thinking again of the COVID examples and the COVID legacy in which wealthier countries just sort of hoarded the vaccines at the expense of more vulnerable countries, particularly in Africa. And I'm wondering if we're seeing like a repeat of that same movie.
I don't know yet. It's been a relatively short time. I think countries that have stockpiled vaccines are trying to figure out how much of it they can donate. I think other companies may be trying to figure out what they can do. It's going to be a matter of cobbling together vaccine. But There are two fundamental problems. Problem number one is there's the public health point of view, which is that any country that has appropriate vaccine should donate it to the countries where the disease exists. And it's in our own enlightened self-interest to do so. The other point of view is the political point of view, which is, or to speak from the perspective of the U.S., if the U.S. is concerned that MPox may come here and cause an outbreak, which is what the declaration of a public health emergency of international concern means, then it's politically virtually impossible to give away the majority of the stockpile that's needed to protect the U.S., even if it makes public health sense. So that's sort of where we may be. And it's not just the U.S. The same thing happened during COVID with many other countries where they were unwilling to give away large amounts of their vaccines until they had enough vaccine for their entire populations.
Is one way out of this problem potentially speeding up that timeline that you referenced earlier, 18 months to scale up production of this vaccine to 10 million? I mean, with enough funding and political will, could that timeline be scaled up?
I suspect it could be. I think with, as you said, sufficient funding, political will, and also with the cooperation of the companies, which might take some convincing. The companies that are currently making it can only increase their manufacturing so much. The way we could increase it much more is by having other pharmaceutical companies also make the vaccine, which means that the companies that are making it now would have to essentially give their intellectual property to other companies, which they are not eager to do.
Like, the Serum Institute in India is known for being able to rapidly ramp up production at low cost of these kinds of vaccines. So, one option would be to do some intellectual property sharing. That would be good for public health. I'm sure this Danish company would still make a lot of money.
I think they would. And I think that is a potential solution. And it is one that has been discussed at length. I don't know whether it's being discussed today, but it's been discussed at length with regards to COVID and other outbreaks, trying to find ways that can have distributed manufacturing of products that have IP protection. And so hopefully we have made progress in that realm over the last decade that I'm familiar with. Discussions have been going on.
So we are speaking on Thursday, August 22nd. Not long after the WHO issued its declaration, the Public Health Emergency of International Concern. Looking ahead the next week or two, what are you looking towards that will suggest to you what comes next for this outbreak?
Well, the thing that I would look for most is for evidence of community transmission in a country with modern healthcare. So if there was transmission of cases in Sweden, where there was a single case so far, or if there are cases that arise in other countries with good public health and healthcare capabilities, that would concern me quite a bit. But we're also looking at how many more cases there are in Africa, so how rapidly is it continuing to spread, and learning more about the severity of the disease as we get more clinical data in. So we're watching all of those things, as well as watching the ongoing negotiations and collaboration that WHO is trying to put together to get vaccine to where it's needed.
Well, Eric, thank you so much for your time. This was really helpful.
Well, you're very welcome, and I hope you feel better.
Yeah, thanks so much. Thanks for listening to Global Dispatches. The show is produced by me, Mark Leon Goldberg. It is edited and mixed by Levi Sharp. If you are listening on Apple Podcasts, make sure to follow the show and enable automatic downloads to get new episodes as soon as they're released. On Spotify, tap the bell icon to get a notification when we publish new episodes. And of course, please visit globaldispatches.org to get on our free mailing list, get in touch with me, and access our full archive. Thank you.